For adults in particular, we look at the reasons they stay in the hospital for a little bit longer. And that goes into our extended stay section with the main guideline. We also have a whole section, a whole robust group of guidelines called common complications. So it's a lot of the times when you come into the hospital and you come in for a particular problem, and then unfortunately, either a well-known complication like bleeding or renal failure that's just a part of the treatment process and the disease process happens. And then we have guidelines that can walk you through all sorts of steps. So the first step would be, what can you do to prevent this from happening? Second is, well, it's happened, so what things would you need to do to both treat it and evaluate it? And then finally, do they need to have that done in the hospital, or can they have that done in another setting and safely done? And in general, being in the hospital is not very good for you, so we try to encourage them to find another way. And so we gather that data and present it for people so that they know that, that can be done in a recovery facility or with home care. Because we look at data that includes everybody, we have patients that already have all of those problems. So if we're looking at our heart failure guideline, they have hypertension, high cholesterol. That's just the nature of that disease process. So we include all of that information. Things like good glucose control for patients who are diabetic are embedded in most of our guidelines. And then for very common complications that always travel together, we have a whole other group of guidelines, and there's about 60 of those, and they're called the MCMs, or multiple condition management. And so those guidelines are those particular patients who have heart failure, for example, and they also have diabetes, or they have a renal failure that's aggravated right at the time of admission. So they have two things going on. And of course, most clinicians will say, yeah, none of my patients have just one thing going on. They've got lots of different things going on, and that's why they're sick enough to be in the hospital. So that's one of the ways we get a grasp on that. The use of the Premier database, which is what we've been using, again, another database that we've been able to access a few years ago, gives us information on the medications they're taking, as well as some of the laboratory data and other pieces of information that we can actually pull out and say, hey, this patient was admitted for heart failure, but they also got dialysis, and therefore they definitely have renal disease. And this patient was being treated with IV insulin. This patient was getting medications for really bad COPD exacerbations and antibiotics and nebulizer treatments. And so we can pull that out and say, okay, this is a little bit of a different population, and we can say something different about them and help navigate that patient through their hospitalization.